Welcome back to Every Minute Counts. Just before the break, we showed you a PSA on the warning signs of a heart attack. Well, today we've asked Education Director Jane Bedford from Nature Coast EMS to come and share some of the experiences that our crews go through as they encounter patients with a suspected heart attack. So Jane, welcome to the show.
Thank you. I'm glad to be here. What our paramedics experience when they encounter a patient who's having a heart attack is different for each patient. Most patients can present, like the PSA stated, with chest pain, shortness of breath. They can become profoundly sweaty, which we call diaphoretic. They could have nausea and vomiting. But other patients sometimes don't present that way. Females, and especially diabetics, they have what we call atypical or not typical signs of heart attack. Those signs could be something as simple as feeling very tired, or they could feel nauseous, or they could just feel sweaty. And those are the patients that are a little bit harder to diagnose.
So what is really the main symptom of a heart attack when somebody's really having it? What is the main symptom we typically see? Most
patients will present with chest pain and shortness of breath, just like the PSA stated. And they'll have, you will know that it's something a little bit different most times. Most people do know they have their heart attacks, although there are people that have what we call silent heart attacks. But the most important thing is to dial 911 and to get the assistance you need at your side right away.
Was there anything you can do if you're caring for, even if you yourself are having a heart attack, that you can do while you're waiting for the ambulance to arrive?
Absolutely. When you dial 911, we have an enhanced 911 system here that we've helped to educate them to direct you or whoever calls 911 on what to do while you're waiting for the ambulance to arrive. We will get there fast, and our guys are very good at what they do. But in the meantime, they'll direct you to take aspirin. Aspirin is important to a heart victim as the dialing 911. You really need to get aspirin on board as early as possible.
What's so important about aspirin? Why is that such a important thing in a heart attack?
Aspirin is important as dialing 911. Aspirin does something to the blood that makes it very slippery. And what's happening in a heart attack is there's a clot in your vessel that's keeping the blood from circulating to the muscle. Time is muscle. So this clot has stopped the blood from circulating to that muscle. What aspirin will do, and it will do it immediately, is make the blood kind of slippery so it'll slip past that clot, or actually move the clot and allow the blood to circulate to that muscle at that time. 25% of the people who actually, aspirin increases the outcome in a favorable way for 25% of the people who have a heart attack, because aspirin does that for you right away. Like I said, aspirin is as important as dialing 911.
So time is really important in these types of situations where somebody's having chest pain or some of these other symptoms. But why is the time so important? What's so important about that time?
Well, when you're having a heart attack, it's the pain you're feeling is from the muscle in the heart not getting circulation. And when it doesn't get circulation, the heart muscle starts to die. But we can stop that process and even reverse it. As soon as our paramedics get on scene with you, they can give you medications that will help reduce the injury that's being caused initially by the heart attack and help improve your outcome.
Well, that's some good advice, and it really bears repeating. If you have chest pain, squeezing pain, numbness in your jaw, and accompanied by profuse sweating, it's very important that you get immediate medical attention. Take some aspirin, call 911, get Nature Coast EMS on the way to evaluate you and decide whether you should be, or how you should be treated and how you should be treated. We'd like to hear from a patient who has experienced a cardiac arrest and lived to thank his Nature Coast EMS responders.
They were outside unloading the trailer, and then he come in and he said that he was hot. And I said, well, it's not hot, Rick. We have it cold in the house, because I had surgery the day before. He walked out of the room, came back in, and I had taken most of his clothes off, and he said, I'm really hot. And he started rubbing his chest, and I said, is your chest hurting? And he said, no, not really hurting, just tight. And I said, okay, well then I'm calling the ambulance, because the Saturday before he had signed out AMA. And He said, no, I think I'm going to be all right. And I said, no, I'm calling the ambulance. Walked around the corner and picked up the phone, and as I'm dialing 911, he dropped. 911 operator kept me calm and collected, and tried to get him to the floor to get CPR started on him anyway. And by the time I got him to the floor, thank God the ambulance had pulled up, and they come in and, I mean, just started right in on him. They had to shock him like 4 times, you know, to finally get a heartbeat. I don't know if they were able to keep one, but they started the ice therapy in the ambulance, and that's what saved him. Oh, I love him. And I'm telling you, I love the EMS people, I'm telling you. Because if it wasn't for them, Rick wouldn't be here. Because they started the whole process. Like I said, they were great. You know, if it wasn't for EMS, he would be dead.
That's quite a story. Floyd, would you mind sharing with our audience some of the things that our crews do when they do arrive at a scene of a medical emergency of someone having chest pain or cardiac arrest, and then also some of the training and preparation to work some of those scenes?
Sure. When our crews arrive on scene, they bring in all the equipment and that they need to render care for you if you're having chest pain or if you're having any emergency for that matter. Our guys train a lot. They're very good at what we do because we train and train and train. The state of Florida says we have to have 32 hours of continuing education for every 2 years of your licensure. We offer at Nature Coast EMS over 200 hours a year, free to our team members, and our team members take advantage of that quite often.
What kind of specialized training does the paramedics receive to prepare themselves for these types of calls?
Our paramedics are trained to an ACLS standard, AHA, ACLS standards. We are an AHA training center. We teach all of those classes. And on top of that, we also offer a critical care paramedic program at Nature Coast EMS for those really high acuity patients. Those high acuity patients that are really sick, our guys have training above and beyond what the state mandates that we have to treat those patients also.
Well, what difference is the critical care paramedic training over just the standard paramedic training? The
paramedic training, critical care paramedic training is 80 hours of high acuity care, monitoring intravenous lines, intra-aortic measuring devices, treatment modalities that the medics are not taught in normal medic class, high acuity treatment modalities and high acuity care.
Well, thanks, Floyd. And when we come back, Floyd's going to walk through the actual steps as we run a 911 call with somebody with chest pain. But first, we'd like to give thanks to our sponsor, Easy Living Furniture, for sponsoring this beautiful set that we're using here. And we'd also like to share a message with you about an important way to notify your loved ones if you would be in the middle, have a medical crisis and not be able to contact them. So we'll be right back.
We were supposed to have coffee and I found him like this.
Sir, can you hear me?
Is he a relative?
He's my brother.
Is he allergic to anything?
I don't think so.
I've got a weak pulse.
Is he taking any medication?
I don't know. I don't know. He's got this medical card thing, whatever it is, on his keychain.
That's what we need. Let me see it.
The invisible bracelet. It speaks for you when you can't. Electronic health information powered by the American Ambulance Association.
Welcome back to Every Minute Counts. When that pre-recorded segment, you heard some from our cardiac arrest survivors, and it was pretty miraculous to hear their stories and how it changed, how it affected their lives. I've asked Floyd to come back and explain exactly what happens when we do call 911 and happens on that call when we do treat someone. So Floyd?
When you dial 911, your call goes to a call center here in the county that's ran by the Citrus County Sheriff's Office. Those dispatchers, we have trained with them and trained them and given some pre-hospital instructions, pre-hospital advice to you prior to our arrival. And again, the aspirin is the big one, the one Jane talked about earlier. They're getting the patients to give themselves aspirin long before we get to the hospital. So when they call in with chest pain, they're being advised on the phone by the dispatcher to go ahead and give themselves aspirin. And we train and train and train to make sure that that aspirin gets on board, because it's that important. As Gene said, it reduces the mortality rate. 25% of people that are going to cardiac arrest are people that are having a heart attack. Once we arrive on scene, our crews come in again with all their equipment. First thing we're going to do, we're going to start asking you the same question the dispatcher probably asked you. Where's the chest pain at? Where it started? What were you doing when it started? Does it go anywhere? Have you ever had it before? And simultaneously, while we're doing that, our EMTs are going to be getting baseline vitals, your blood pressure, your heart rate, hooking you up to the monitor and see what's going on electrically with your heart, see if there's anything going on that way. And then again, we're going to give you that aspirin. If you haven't already taken it, we're going to give it to you. And within 5 minutes, we're also going to give you a medication called nitroglycerin, which is going to help open up those blood vessels to try to get blood flow back to that part of the heart that's not getting blood flow. The pain that it's causing, it's like a cramp that you have. It's not getting oxygenated blood to that part of your heart. We want to get that blood flow back going to that heart, and the way we're going to do that was with the medication that we give.
Mm-hmm. And oftentimes people are having pain, and we give them something to treat the pain, but we do more than just give it to them for pain.
Right, the nitroglycerin that we give them, the nitro pills that we give them, opens up those blood vessels. It opens up those blood vessels, so if there's a clot in there, we open them up and make the hole bigger so blood can get around there. So we give them the aspirin to help make their blood a little slicker, then we open up those blood vessels to give more room for the blood to get by that clot to help reperfuse that heart or give that heart the oxygenated blood that it needs.
So time really is important in these cases.
Time is extremely important. Like I said, within 5 minutes on our arrival, we give it. We're hoping that we give it before, and we're finding out more and more once we get on scene. Dispatchers have already instructed them to give their medicine, to give them their aspirin, and they've already had it, which helps that much more.
So the 911 center they're trained in emergency medical dispatch, and emergency medical dispatch is that technique which they ask the questions and give that treatment. How long do they stay on? How long do they stay on the phone with the caller when they do that? Do they just give them the directions, or are they often on the phone when we actually get to the home?
More often than not, they're on the phone with the dispatch when we walk in. Because when we're walking in, they're like, "Well, they're here now. Can I let you go?" And the dispatcher will be like, "Yes," and they'll hang up with them. Or dispatcher sometimes even calls, "Hey, can you hang up the phone for the guys? The phone's still off the hook for listening to you."
So how do they decide which ambulance to send to that call?
They send the closest ambulance. With the new automatic vehicle locators that are now in all of our ambulances, they dispatch the closest ambulance to that call.
And then how many locations do we respond from throughout the whole
We've got
county?
9 posting stations throughout the county. We have 13 units on during the day, and we send the closest unit to that call.
Great. So is there a particular hospital that these patients have to go to, or which hospital do we take them to?
If the patient's having chest pain, at this time we take them to Citrus Memorial Hospital. They have the full service cardiac healthcare unit that is able to treat the chest pain and to treat the patient to the end result.
Great, great. Well, thanks, Floyd. As part of our month-long focus on health and heart health and EMS, we're going to continue with the next 3 weeks with different topics on heart health and heart emergencies. We'd really like to thank you for being part of our first episode of Every Minute Counts. And we thank our sponsors and thank Jane Bedford and Floyd Mead for being a guest on our show. And we look forward to seeing you again next week.